Matthew is with the Community Engagement and Partnership, or is the Community Engagement and Partnership Coordinator at the VA Hospital in Ann Arbor. And he's going to talk to us tonight about community-based interventions for suicide prevention. So go ahead, Matthew, take it away.
All right, thank you very much. Let me go ahead and throw my slides up on the screen here real quick, and we'll get started. Okay, great. Well, thank you very much for having me. I really appreciate the invitation. We'll go ahead and get started, and I'm going to start my timer here on my desk because I'm sometimes notorious for going a little bit over my time, but I've gotten a lot better at it. So again, thank you, Dr. Paulissen, for inviting me to come and speak. September actually wraps up Suicide Prevention Month for us in the suicide prevention world. So that's really kind of our exceptionally busy time to be kind of doing trainings and different presentations and whatnot. So I'm actually happy that, we're sort of continuing the conversation on this topic outside past September, and happy to be with you this evening. So if it's okay with everybody, I would say as I go through this material, if there's any questions that come up, please feel free to just unmute and ask some questions. I probably won't be able to see if you raise your hand or something, but please do just unmute and ask any questions you may have. We'd definitely appreciate that. And with that being said here, I'm gonna move this over here, and we'll go ahead and get started. So the topic is usually the topic of suicide can be heavy. So if anybody has any connection to this topic at all, whether it be personally or known someone who's passed by suicide, or have a loved one that struggled with this, if something kind of comes up for you during this, feel free to to get off camera, do what you got to do to take care of yourself, and know that our 988 crisis line is also available at any time as well. This particular discussion probably is more surface level in the sense that it's not a detailed training into really getting into the weeds with suicide prevention in respect to a gatekeeper training. And what I mean by that, if you're not familiar with that term, is trainings that are done on the community levels for anybody to learn more about risk factors and protective factors, and how to recognize signs that someone's not doing well, and how to intervene and have a conversation. So this training is not that. What we're going to talk about today is really the VA's public health approach to suicide prevention and the efforts that are being made in that regard. So those are things that we do as well. We do those trainings as well, but today is going to be a high-level overview, and we'll swoop down into the weeds on a few things, but it's going to be a little bit more informative than anything. So not a surprise, suicide continues to be a national problem. It affects veterans and civilians alike, but veterans definitely do have different risk factors, and overall are generally at about 1.5 times greater risk of suicide compared to the non-veteran population. And for those familiar with the veteran population, it is quite a diverse population. Within the veteran population, there is a whole mix of folks with, even in looking at suicide research and data, the whole host of different groups that have different risk factors. At times we'll see suicide rates in particular groups go up, and others go down. And it's a very complex thing, and it's also a very difficult thing to study and to research. But there's some good news that we'll talk about as we kind of go through this training. But there's lots of things at play. So needless to say, there's societal, there's individual level, there's community level things happening. And so there's not generally one thing that contributes to somebody's death by suicide. It's generally a combination of several different things. And with that being said, when someone does die by suicide, it roughly impacts roughly about 135 people around them. So this is really something that's not happening in a vacuum. It impacts a lot of folks, and that's what we're here to talk about today. So As I mentioned, we're not going to get into too much of the weeds here about different risk factors and things like that. But veterans who come to the VA for healthcare have definitely some interesting and unique risk factors, and those differences are clear between veterans and non-veterans, and even veterans that are either engaged in VA healthcare or not engaged in VA healthcare. So, for example, homeless veterans are, or some who have received homeless services, may have higher risks of suicide compared to housed veterans. And we know things like social connection plays a very big part in suicide risk factors as well. Whether or not somebody has a meaningful relationship with another person, whether it be in a marriage or whatnot. Some of this does mirror a lot of the data that's found in the general population and the U.S. adult non-veteran population. So, for example, those that are divorced or widowed generally have higher risk factors for suicide compared to those that are not. And there's several more that we could get into, but this is just a couple that I wanted to mention. Also, roughly about 65% of veterans that die by suicide are not connected to VA healthcare. And that's a little bit of, we'll kind of get into that a little bit here too. That's really one of the major reasons for my position being created. And we'll get into that in a little bit. If you're interested in data, there is a lot of data as it relates to suicide death in the U.S. and the VA also puts out a lot of information every year. They'll put out their annual report. Within that annual report, you can find all sorts of data points on there. So if you're interested in that, just know that it is out there. I believe 2022 is the most recent one that is out. And they also have state-specific data that goes along with that too. So, as I mentioned, we won't get into too much of that data in this discussion. But if it's something that interests you, it is definitely available. So, at the VA, and I work at the Ann Arbor VA healthcare system there as part of the suicide prevention program there. It is the top clinical priority for the VA, and what I mean by that is ending veteran suicide is their top clinical priority. Veterans don't live, work, and serve in isolation outside of the community. Veterans live in the same community as us. The issue of suicide in the United States also impacts the veteran population, and as I mentioned, they're roughly at about 1.5 times higher risk of suicide compared to non-veteran U.S. adults. So the motto that we really put out there and where a lot of suicide prevention efforts are going is that suicide prevention is everyone's business. Not one system out there can prevent suicide. It's a shared responsibility. And as the evolution of this work continues, that's really what we're seeing more and more. Our collaborative efforts between different agencies, talking on the federal, state, and local levels, and really kind of looking beyond the individual themselves to kind of get the support and the help they need. We really need to come together as a community and provide space for folks. And of course, I'm talking particularly today about veterans, but this really goes for anybody experiencing any kind of mental health issues or struggling in any ways with suicidal thoughts. But because we're talking about veterans today, that'll be what I reference throughout this discussion. But know that I'm also speaking generally for the population at whole. So we really do need to involve our communities in these discussions, build big networks, change the conversation around suicide. It's not really a thing where it's just an issue for someone to work out with their therapist or their psychiatrist. It does take really a community level approach to have an impact on this. And there are some community-based interventions that we'll talk about as we kind of go on. So, so the Suicide Prevention 2.0 public health strategy is the language that we use in the VA, and I'm going to try not to say a lot of acronyms. That the VA is notorious for that, and if I do, please stop me if there's something I say that you're like, "What is that?" We're notorious for that, but this is the language they're using to describe their public health strategy, and it's a combination of a community-based approach along with the entire clinical side that's happening with the care that's being provided at the VA, and that really combines to their full public health model. So with that being said, we're going to talk a little bit about what this means in some more depth here as we go on. So what do we mean when we say, let's start with probably the easier to describe of the two, which is our clinically based interventions. This is basically everything you would think about as far as someone coming in to get treatment. Whether it's mental health treatment, behavioral health therapy, medical. That's the entire holistic whole health approach, and that's all of our clinically based interventions. So evidence-based treatments, different types and modalities of therapies. That's everything you would think of when you think of someone going to receive behavioral health services. And then we have our community-based prevention strategies, and you'll see my job title is up there, community engagement and partnership coordinators. These positions were rolled out nationally probably about 3 years now. 3 years ago, they started coming out, and it is nationwide. And we do in Michigan cover every county in Michigan, all the way from the UP to Lower Michigan. And we'll talk a little bit about what my role involves and what it breaks down to. But they have the VA has undertaken substantial veteran suicide prevention efforts. Their public health approach for veteran suicide prevention, it really incorporates long-term community-based and clinically based initiatives as part of their 2.0 initiative that they call it. All right, so this is the abbreviation essentially of the work that I do. Community-based interventions for suicide prevention, shortened up as CBISP. This is really just kind of showing that the work that we're doing is in partnership with a few other agencies, including SAMHSA and the MVAA, which is the Michigan Veterans Affairs Agency. And the CDC has put out this technical packet here, or toolkit on strategies that is based on all the evidence that they can gather. So what we're looking at here is, and this toolkit, is available, I think, in the resources section of the slides. There's a link to it. But these strategies represent, what we have to focus on in preventing the risk of suicide in the first place. So it's really an upstream approach. We will jump in the water. We do have folks at the VA, our suicide prevention coordinators, who will respond in times of crisis. We have the Veterans Crisis Line. There's lots of things there, which can always be improved, of course, but lots of interventions available. And that's what we usually think about when we think about, suicide, when we have intervention, but we're really talking about prevention today. So how do we get upstream? How do we get ahead of the crisis? How do we make things better before somebody finds themselves in that position? And if you look at just some of the very, brief bullet points here, you'll probably see that none of this probably requires a, PhD in, a specialized degree to really make a difference here. These are things that we can do on an individual basis, that we can promote on a community level, and that we can really create space for in our communities. So we'll get into this a little bit more here. Our main three priority areas are identifying service members, veterans, their families, and better screening for suicide risk, promoting connectedness and improving care transitions, and increasing lethal means safety and safety planning. So our program promotes these priority areas and emphasizes the critical elements that fall within these. But these are also very broad goals, which in a way also allows us to be a little flexible too when we're working in the community to incorporate different strategies under these 3 priority areas here. So these all shadow what the CDC is recommended for community-based interventions for suicide prevention. And I just want to actually speak a little bit to each of these. And as we go on in this discussion, hopefully it'll start to make even more sense as to what this actually means. So, for example, promoting connectedness and improving care transitions. It sounds great. What does it really mean? So, how do we promote connectedness? How do we create communities where people feel included? These are challenges that not only the VA faces, but many other community organizations as well too. But a couple things I want to mention. Some of the highest risk times for veterans are during periods of transition. And that includes mainly transitioning from military to civilian life. That's a major transition, but also many veterans end up, in going into higher education. And there's another big transitional phase there too. And we could spend probably the whole time talking about all sorts of different transitions. But I just want to mention that these are points where we can sort of focus in the communities that we are a part of and look at how can we make this better? How can we make this process smoother? Transitions from incarceration to civilian life. So in the state of Michigan right now, there are efforts in some of the Michigan prisons that are looking at just that. There's lots of things already underway that are happening where we have folks not just from the VA, but from community organizations that are working with veterans. There's been in some counties we're working in, there have been, for example, some specific veteran probation treatment tracks that have been put in place in the county levels through the courts there. Community-based interventions for suicide prevention can include a lot of different things. I'm trying to throw out some examples off the top of my head, shooting from the hip here, of some of the things we've done personally. Another example would be through the Michigan Mobility Wallet. There's been a 4-county collaboration: Hillsdale, Lenawee, Calhoun on the other side of Michigan, and in Jackson County, where we worked together with some partners and created a centralized transportation system hub with Phoenix Mobility and some other folks. And long story short, have now accessed free transportation for veterans in those 4 counties, and that's going good for a year for now. And that is to literally anywhere they need to go. So whether it's grocery shopping, medical appointments, places where they can engage in social connection. Lots of people wouldn't probably think that transportation would be a suicide prevention strategy, but it is. We want folks getting to the appointments where we know they're going to be doing better with, improved healthcare outcomes. Social determinants of health is a new buzzword that's going around for a while. And these things all improve when people are able to get to the places they need to go, when they're able to get to the appointments that are going to help them and do the things that they would normally do when they're not restricted by transportation. So there are lots, I guess all this to say that there's lots of interesting methods in which suicide prevention, and lots of ways suicide prevention can look. And those are just a few examples of that. Some of the other work that tends to get noticed a lot is work with lethal means safety. So that really boils down to lots to do with what we call lethal means safety. Lethal means safety meaning that when someone decides to take their life, they usually have a method by which they are going to do that and execute that plan with. And lethal means safety is really all about putting time and space between that person's decision and their ability to access that means. So we partnered with different gun shops in the counties that we've work in. We've created some partnerships where we're able to provide gun locks to county health departments, to various other organizations, and we've literally distributed thousands and thousands of gun locks that people take voluntarily. And so there's lots of initiatives on this right now, lots of things happening, not just through the VA, but also on the state level as well with our partners at the Michigan Veterans Affairs Agency. Safe prescribing practices, safe de-prescribing practices. These are all things that are falling under the lethal means safety and safety planning area here. So lots of initiatives fall within these three categories here. And the big picture is in 2018, the VA put together their national suicide prevention program, and it's a 10-year program with all of this included in there. That's sort of the big picture. And then on the state level, it comes down to the partnership between SAMHSA and the MVAA. Through that partnership, you have community-based interventions and the CEPCs, which is my role, the community engagement and partnership coordinators, together with veterans, is generally found in more rural areas. And we do have one coalition in the UP, which is called Together with Veterans. That is a veteran-led coalition that is very similar to the coalitions that we try to connect with in our counties, generally suicide prevention coalitions, or creating veteran-specific coalitions and bringing folks together from the community, from organizational levels, through whatever partnerships are interested in working on these things. And so on the state level, we have this governor's challenge, which I'll talk about here in just a minute. And that is one that is strong in Michigan. If you haven't heard about it, you are about to. So from the state level, then it kind of goes down to the community level work, which is where our CEPCs and myself do this work. So I'm going to skip over this one. Pretty much already said it. But the governor's challenge is it is a partnership between the three agencies, and right now they focus on the exact same three priority areas that I just mentioned. So they were pretty strategic when they put this all together. So the MVAA literally has the same priority areas that we're working on the community levels, which matches and meshes up with the national strategies. And I'll talk about this here. I believe now all 50 states, there may be one or two that don't have a governor's challenge. Some of them are mayor's challenge, depending on where it is. But essentially, this is work that is going on nationwide. So let's speak a little bit about what's going on here in Michigan. We do have an active governor's challenge team, some great leadership over there, and the work is going on every day. So let me talk a little bit about that. So same exact three priority areas, and I'll give some examples too on the state level of some of the things that are happening here. In Michigan, we actually are right up there with having one of the most concentrated veteran populations in the country. So we actually rank 11th with roughly about 567,000 veterans living in Michigan. On the right-hand side, you'll kind of see a little bit of a breakdown of some of the more concentrated areas where veterans are living. You'll see Ann Arbor is roughly 60,000, Battle Creek about 57, and you can see from there Iron Mountain is up in the UP, and there's roughly 24,000 veterans living there. So we have a very healthy veteran population here in Michigan. What you will see also at the bottom here is that 315,000 are not connected to veteran health care at the VA, what they call VHA, Veterans Health Administration. So essentially VA. And you might be asking, wow, like that's pretty surprising with 600,000 almost veterans living in Michigan. How are half of them not even connected? That's a good question. And that's part of the work that we try to do. We definitely, our goal is not to siphon people into the VA to get their treatment. In fact, none of my job responsibilities include bringing veterans to the VA. We want to just make sure that those 315,000 that are not connected to the VA are getting their health care somewhere else or being taken care of on some kind of community level, if not through the VA. Now, there is a program through the state efforts that we're talking about here through the MVA that are looking at how to engage those 315,000, and I'll get into that in just a minute. But a lot of times, and there's a lot of reasons why veterans may not be connected to the VA. It could be personal preference. It could be limited access to facilities. It could be transportation issues. It could be financial concerns. It could possibly be that if their income is too high, they may not be eligible. So there's definitely that piece of it too. So it's not just that veterans don't want anything to do with the VA. There's a variety of different reasons. Those ones are out there too.
Could I ask a quick question?
Yeah, please.
I've been told that part of the trouble for veterans is that many of them don't bother trying to get connected to the VA until later in the life when they really need to. And at that point, then the administrative delays can really be a problem. So the suggestion was that all veterans ought to get connected earlier in their life so they'd be able to take advantage of those services later in life when they need it.
Yes, and there are efforts, and I would agree with that statement. Sometimes also veterans aren't even aware that they're eligible for some of these services. I can't tell you how many times I've connected with folks and they said, well, I would have never known I was eligible for getting hearing aids or for prescriptions or for healthcare. So not everybody's even informed, but there's big efforts right now going on underway between DOD and the VA side trying to make that connection. There are programs in place that are supposed to be doing just that, but I think that's where they're really moving. So it's a good point that you bring up. There's a program called Solid Start that tries to connect transitioning service members to VHA and through the VBA. So if folks aren't aware, the VA is actually a combination of the National Cemetery, the Veterans Healthcare Administration, which is VA hospitals, VA healthcare providers, and then also we have the third piece of that, which is now, of course, escaping my head because I'm talking about it. But we have National Cemetery, VHA, and VBA. Thank you, brain, for kicking in, which is where people's benefits are determined. So Veterans Benefits Administration. So with that, DOD is trying to do a better job of bringing people over to us on our side of the house. There is a program and an initiative happening in Michigan called the Michigan Veteran Connector Program. And this program is really there to try to better identify veterans. Another thing I didn't mention is another challenge to this is a lot of veterans do not identify as veterans as well too for various different reasons. So on different forums, if folks if organizations ask if someone's a veteran, they may not even answer yes to that because they don't identify as a veteran. And again, that's for a variety of reasons that we won't go into today. So that's why this program really encourages organizations, agencies, anyone can become a Michigan Veteran Connector through the MVAA. And they really want to ask the question, have you or a member of your household served in the military? It's a great question. It's a great way to get a very forthcoming response. And with that, it allows us to make a connection there. It allows us to provide maybe some information. And by the way, did you know that you can call this 800 number here and they'll ask you 15 questions and tell you within about 2 minutes whether or not you're eligible for any kind of benefits at all? Fantastic. I guess I'll do it. So that's part of their initiative. A lot of times, as I mentioned, veterans aren't even aware they're eligible for benefits. Sometimes they could be eligible for a VA home loan, and that may be the only thing they're eligible for, but they would have never known it if they've never applied. Other things come into play too. I've already got insurance. I don't need to go to the VA. Well, that's great, but it would never interfere with whatever personal insurance you may have. So it doesn't, if you had Blue Cross Blue Shield through your employer, you could still get your benefits and still possibly even get a disability rating possibly, but we would never know that unless that person really explored it. So there's lots of initiatives trying to reach veterans, and work being done to with the Secretary of State, trying to better identify veterans in our state as well too. So this program is similar to so if you had a business, or if you were an organization and you wanted to better connect veterans to their benefits, you'd get a little training as an organization. You'd be informed as to what's available, what are some informational pamphlets you can hand out, how can you get folks connected to their benefits. So they would get training, you get some things to put up on some materials for the storefront, or materials to pass out, and then that allows you to sort of potentially reach some veterans that may not ordinarily would disclose that they were veterans, let alone reach out for any type of support. So this is a big push that's happening in Michigan. You may see little stickers in people's counters or storefronts that would identify them as a Michigan Veteran Connector, and it opens up that conversation to exploring more and being able to better identify our veterans in the community. So if there's a yes, we can ask them, is there anything you'd like to know about this program? Is there, do you mind if I share some resources with you? By the way, did you know you can go to your county office and apply for anything there? Lots of things that are just, that's not common information. So that's one example of one priority area that's being worked on the state level. Already talked about Together with Veterans here, which is our more rural coalition that's happening. We'll get into a little bit more about the community engagement portion here. So a lot of what my role is, aside from doing trainings and discussions like this, I wouldn't really consider this a training, but what we try to do is really coalition work. So we really try to bring together on the community level, what's happening in our communities, what's happening in each county. So, for example, in Washtenaw County, we have the Washtenaw Alive group, which is our suicide prevention coalition. So in a situation like that, we say, great, there's a suicide prevention coalition. Let's see what we can do to connect with them and partner, and really maybe try to bring a veteran focus to some of the work that's being done, and build it from there. It's really been sort of amazing seeing some of the things that have come through some of these partnerships. And I'm lucky to kind of be in that role and cover the few counties here in Michigan, and actually a few in Northwest Ohio as well too, as we have a total of 19 counties through the Ann Arbor VA that we cover. So that's what my role is, and that's what really I try to do in lots of different ways and many shapes and forms. On the flip side, our suicide prevention coordinators are the clinical folks at the VA that provide enhanced care for veterans at risk of suicide. And that's more on the clinical side of things here. I've already kind of explained those differences. Our work is community-based and prevention work, and on the other side of the house is our clinical work that's helping folks on the individual level there. Already spoke about this. Really, this is just kind of showing that partnerships lead to better outcomes, and that's what I was really kind of getting at the beginning. Everything's moving this direction, and especially when it comes to suicide prevention work. So really what we're just kind of listing here is that our national strategies, all the things that we're working on, all the partnerships we're trying to create on the state, local, and federal levels, they're really backed by evidence-based research that really indicates that this is the way to go. If we're going to have an impact on this, this is what we really see as being that has the potential to be impactful. So we have our Governor Challenge partnerships. Through that, if you become a Michigan Veteran Connector, folks can get access to a Psych Armor portal, which allows them to have access to all sorts of different trainings, 15 things a veteran wants you to know. Just lots of things that would help improve, becoming more familiar with military culture, things like that, how to really connect if you're a healthcare provider working with veterans. So lots of great information there that becomes available to anybody or any organization at no cost that wants to become a Michigan Veteran Connector. Partnerships with the National Shooting Sports Foundation, They've actually helped co-create some of the lethal means safety material that we put out into the community. So that's kind of where this work leads us here. Our short-term objectives, enhanced suicide prevention networks, better understanding of where the gaps are in the communities that we're working in. How do we help fill some of these gaps? How do we bring the right people to the table? At the end of the day, what's really going to speak to these efforts, and we've been told maybe 6 or 7 years down the road, we might start to see some of the results of this work actually reflective, hopefully, in reduced suicide deaths. So that's the ultimate goal is a reduction in suicidal deaths, reduction in suicidal ideation, better outcomes when we look at social determinants of health. These are all things that we're looking at here. So with that, I think I did bring us right to kind of the conclusion of where I kind of wanted us to be, I think, with maybe some ample time for a few questions, if there are any. The remaining slides here are just resources that are available. And, I don't think there's anything really too much I want to touch on here, but I'm going to skim through this. And I believe Dr. Paulissen said she could make these available for everybody as well, too, and have these sent out. So I won't really dive into too many of these. I mentioned the psych armor, but there's tons of different resources for veterans. This is a veteran vet to veteran support, maketheconnection.net. There are also supports like coaching into care, which are for family members and friends of service members and veterans, where if they know someone needs help, but that person isn't quite ready, or it may be hard to have that conversation, this is a support for the families and friends of those folks, where they can get some coaching as well as to how to have some of these tough conversations. The Be There campaign is for reaching out to veterans in the community. We have the social media safety toolkit, the lethal means safety toolkit. So I'm not going to kind of bore you with all these, but just know that there are a lot of different resources out there. Last one I'll mention is also a consultation program for non-VA healthcare providers who are working with veterans. And if they've discovered that there may be a risk of suicide and they would like some additional support through the VA, they can actually get that as well, regardless of whether or not that person's connected to benefits or whatever it may be. In a nutshell, that's that's a lot of the efforts that are kind of being made right now through the VA, through their community-based approach to suicide prevention. And happy to take any questions if there are any.
So you mentioned the training that you had, was it 3 programs that you go out in the community and you offer the training to what, clinicians, or what kind of groups is that applied to?
Yeah, so we do some gatekeeper training. So for example, if folks have heard of like mental health first aid or QPR or assist, these are VA SAVE is one of these trainings where we get familiar with risk factors, protective factors, warning signs of suicide, how to identify someone who may be at risk, what to look for, and most importantly, how to intervene. Those are trainings that can be done for any group at any time. We have ones that are a little more focused clinically for healthcare providers. So for clinical folks, it gets into a little more detail, but the ones that we generally present are community-based for anybody. And those are great trainings. I think they're great trainings. Evidence shows that people retain that information for a period of time. So the likelihood of, just like CPR, the more people train in CPR, the better the chances that somebody's going to get the help they need when they need it. And that's where these gatekeeper trainings come in handy as well too. So we do that. Some of us are trained in other gatekeeper trainings as well, like QPR. Yeah, so we have the VA, what we do is the VA SAVE program is what it's called. So it's just another form of a gatekeeper training.
That's what I wanted to ask about. And you kind of answered it. Like, I would think that many, people in crisis and the ER and the hospital might be the place where they might end up. And the social workers there, do they refer people to the VA, or do they contact the VA, or what? How does that work?
Yeah, it's kind of depends. So if for example, if folks end up in an emergency department, now there's something that some new I get too excited when I talk about this and I start skipping things here, but there's some new legislation. I'm glad you asked that because there was legislation just passed. It's called the Compact Act. Where now any veteran, well, there's a few little, disclaimers there, but virtually any veteran that's not been dishonorably discharged can go to any emergency room now and get acute treatment for a suicidal crisis. And so this is a big thing now where we are now really reaching out to a lot of our community hospitals and partners, educating them on this new legislation, because as this has come out, we are also adapting and putting this, things in place that we need. So to answer your question, now more than ever, I think there's really good collaboration happening between the community hospitals and the VA. So what the VA has said is basically this legislation has said, it doesn't matter if you're connected with VA benefits or not. As long as you've not been dishonorably discharged, if you end up in the hospital, we will we'll pay for all of the inpatient care. And I believe it's up to also 90 days of outpatient treatment as well too. And that would be for an acute hospitalization or a crisis residential stay. So that's been something that's a really good step in the right direction. And so now there is that collaboration. Also, a lot of times people don't know too, when, for example, folks call the crisis line 988 and it says, if you're a veteran, press 1, they press 1, they talk to somebody. If that call warrants anything that would require a follow-up, that information is directly passed to where that veteran lives, to their local VA, and that's where our clinical side kicks in. So on the local level, then also a suicide prevention coordinator would reach out to that veteran and make an attempt at least 3 times to reach them, to also connect with them as well too. So yeah, now I think more than ever, we're getting some good collaboration.
I have another question, and that was about you said the lethal
means safety.
Well, veterans are people that probably know how to use guns and probably have them.
Mm-hmm.
Is there anything, and I think you mentioned something, but is there anything that if somebody is suicidal or in crisis that you can get their guns? I mean, or anything like that? So
that's really, well, to answer it bluntly, no. Because
right.
that's going to fall on state laws. So on average, veterans own about approximately 6 firearms, and that's probably an underestimate. So you're right about that. And they are very well trained and versed in them. Most of them are. With that being said, that's why, with 50% of the US adult population dying by suicide with a firearm and 70% of suicide deaths by firearm with veterans, of course, when we talk about lethal means safety, firearms are the #1 things that we are concerned with, along with, medications and other things, but it definitely is one that's important. So that's where the efforts of lethal means safety training, which is another training we do, another one as well called counseling on access to lethal means. It's all about, at this point, because if a state doesn't have a law like that, right, then who's it up to? It's up to the veteran, it's up to their family, it's up to the community as well too. There's not a place, there are not many places, I should say, throughout the country where someone can take their firearms to be stored safely without having to walk into a police department with the fear of getting maybe a background check or not getting their firearms back. So really, in addition to perhaps legislative things, we also need safe storage sites as well, I think, is a big part of the community where that could help.
Yeah, that's, you said that the VA has given out many gun locks, but are they targeted? Are the families, do they know how to use them? I don't know anything about a gun lock, but is it more personal than just handing it to them? Or,
Yeah,
you know,
so
I just wonder how that worked.
yeah, that's a good question. So with the firearm, they come in a little kind of cellophane package. They come with a card that comes with the Veterans Crisis Line on there with, you know, and on the back of that card, it has instructions on how to properly use that. And so it'll show examples for various different firearms and how to put it on there. So, so in that respect, you know, it kind of has some information on how to use them properly within that. There are things that we do when we do lethal means safety trainings where we'll do some training with that as well too. How is that targeted? So that's a really good question. Of course, at the VA, you know, you could probably find these all over, but we also know that through community efforts that they're going to reach veterans as well too. A lot of times, different community events or different agencies, you know, that we partner with, you know, we can provide them with these gun locks free of charge. We know that they're going to reach veterans. And so that's part of the efforts there. You know, there are agencies that will leave them in baskets in their lobby. You know, kind of like you can get naloxone through a vending machine over here in Washtenaw. No questions asked. Just go there, push a button, and you get it. Same with gun locks. So that's really the sort of culture we're trying to promote with that, and how we get those out.
Well, my question is right along those lines with the gun locks. It's interesting that you've worked with the different gun stores, you said, to get the gun locks. And how did you establish that relationship that they're willing to provide it? Because this is a little jaw-dropping, but because you would think that anyone would be willing to protect someone from misuse of a firearm or whatever. So this is a letter that came from the Firearm Industry Trade Association, and it says for more than 2 decades they've provided gun locks to various organizations that belong to a group called the Project Child Safety Program.
Yeah.
And but this letter says do not provide those gun locks to Moms Demand Action or Be Smart for Kids because they think that we might be lobbying when we're giving out the gun locks. So it's just kind of ridiculous, because if you want to protect people from being harmed by firearms, it doesn't matter who gives it out, who gives out the gun locks.
I agree.
So anyway, I'm wondering how you established a relationship with the gun stores.
Yeah, that's really another good question. It's a courting process almost, you know. I work for the federal government, and so I got to recognize that when I walk into a gun store that's veteran owned at that, and you know, have these conversations. So there is kind of a bit of a courting process, and we just don't really jump into it. We try to establish some rapport. We try to get some kind of understanding. Also, you know, gun shops are required by law to provide gun locks to every firearm that is sold in their store. So they are leaving with firearms. Where the gun locks come in, which it's even surprising to me how people have, you know, even in the community, on the community level, not talking about veteran population, have utilized these gun locks and have taken these gun locks by the thousands, because so many are inherited or sold or bought and sold in different ways, and they may not have come with a gun lock, and they therefore don't have one. That's, you know, I think baseline protection for anybody. And so much like when we have conversations with folks, individuals about gun locks, you got to be respectful of the culture. You know, you got to be respectful of the reasons why people want to have firearms, the reasons why they use them, the reasons they want to have immediate access to them a lot of times for self-protection, if that's part of their self-protection plan. So you have to kind of work with that individual and really understand, and then also try to promote, you know, safe storage. I don't know what letter you're referring to, but what I can say is that, you know, I've worked, we just, in Toledo, they just launched Be Smart over there. And I provided them with 1,000 gun locks. So, I I might be doing something wrong according to that letter, but no, we don't care, you know, as long as this is getting out, you know, Be Smart. There's so many of programs like Be Smart, Project Child Safe that you referred. And that was actually a partnership through the National Sports Shooting Foundation. So they've partnered with the VA, and they're one of the largest you know, organizations when it comes to this, but it doesn't mean that the work's done by any means. Some gun shops want nothing to do with us and what we're doing, and that's okay, you know, but all we can do is really reach out. We're making headway where some gun shops are considering safe storage and being a safe storage location for folks. But it brings up a lot of questions on their end, you know, on the legal side of things, which is you know, been challenging. But there are groups such as Hold My Guns. It's a national organization that looks to create safe storage sites, and those folks have been helpful in having some of the conversations because they have lawyers that are versed in the various states' laws and kind of helps guide gun shops as to what they can do legally and not legally. And so bringing the right people in, you know, being patient. That's, I guess, the best way I could describe how we've tried to build these relationships with gun shops.
Larry had a question, I see. His hands up.
Yeah, I'd like to bring up some of the examples that Matt has talked about. This brochure called Firearms and Suicide Prevention, published by the NSSF, National Sporting Shooting Foundation, and another one called Firearms Responsibility in the Home, and then gun locks, as mentioned. This is an example from projectchildsafe.org. My police station in Saline has dozens of these outside their door, and I pick them up and distribute them at events where my church is doing gun violence prevention activities. So I'm sure they're available in large quantities. And then I'll put in a pitch for my local gun shop, Arbor Arms, off of Jackson Avenue, where I'm a member. They have some lockers that members can rent and store their firearms and ammunition on site at the gun range, so you don't even have to take it home.
That's great. And that's, I think, thanks for that, Larry. I really appreciate you bringing that up. That's where I think some of the safe storage is going to, and is that type, what you just mentioned, you know, lockers where if there's just locker, it doesn't mean there's any type of transferring of a firearm. And so it makes it a little easier for gun shops to be able to do that and to have safe storage without an official transferring of a firearm. So that's really encouraging to hear.
And I see Mary Jo has her hand up now.
Yeah, just real quick. So I especially enjoyed the talk because I worked for the VA for 40 years as the librarian downtown. And I do remember, I think maybe it might have been a RAND report, all this stuff going on about, you know, suicide and how awful the statistics were. And, you know, to try and get some psychologists in and to help take care of the people that were wanting help. And I remember being at getting my car done at Bell Tire. And after I was finished, this man walked over and, you know, you could tell he was embarrassed to ask me, but he says, I've been trying to get into my VA. What I heard you say you work there. What can you do for me? So I called my friend Manny and he set him up with an appointment. And so hopefully everything worked out okay. But in terms of help in the community, so Dearborn has a veteran resource room for veterans. So that's great. And then you probably don't remember these, but there used to be veteran benefit books, real booklets, and those were the most popular things that the veterans wanted. And, you know, we're talking about getting people to know about their benefits, but then they say, oh, you have to go online, you know, and that's crazy. So, and I do remember a couple coming and talking to people who were interested, whose son had committed suicide, and it was with a gun. And it was just so
poignant. But anyway, thank you very much. I learned a lot.
Yeah, you're welcome. Thank you. And, and this topic is, really important because, unlike any other method of, suicide, firearms, you can't take, you can't go back, once that trigger is pulled. That's why we really try to emphasize that. That's why it's got its own priority area, essentially, within our work, because it is truly, and 90% of people who have attempted suicide do not go on to die by suicide later in life. That's really important to keep in the back of our minds, because it's a time limited thing for most people, a time limited crisis that people act on within the first hour of having made that decision. Usually about 70 or 80% of people act on that thought within the first hour. So time and distance between the lethal means and the person's decision really is what is critical and has been really shown. There's not many evidence-based public health approaches to reducing suicide that have been shown to work, except for lethal means safety. And that's why that's one topic we really try to push. So again, those are things that we also have, folks, myself and others that do trainings on for communities on lethal means safety and counseling and access to lethal means and all that. So definitely is important when we're thinking about that, because 90% of, 5%, every other method combined, every other method of suicide combined is only 5% lethal. So that's why, when we compare that to firearms, it's 90% of the time it's lethal. So, so it deserves extra attention, and it's just the nature of the method. So.
Well, thank you, Matthew. You had a lot of information there, and I'm so glad to see the vets are, their programs for veterans. And I know in the past there has not been the best attitude toward the veterans hospitals, and I'm glad to see that they're really working hard to get their word out to the community that these services are available, because that's essential, just essential.
Thank you. Yeah, and I'm happy to, if anyone wants to follow up with any other questions or reach out for anything, please don't hesitate. Open book anytime.
Yes, and I'll make the PDF of your presentation available, and Matt's email is in there on the first slide. So as you said, if you have more questions, or if you want to reach out for the training that they offer, if you think your group might benefit from that, Matt's the one who can hook you up with that, right?
Yep, absolutely. Just reach out.
Okay. Well, thank you all for coming. And it's already 8:20 here. So I'm going to say good night, and hope to see you all next month at our presentation by Michael Waldman.